is diabetes? Because, like I said earlier, a lot of us just think that diabetes sugar is sugar, but what exactly is diabetes?
Okay, thank you so very much for that question. Okay, so diabetes is primarily what we call it's a, when we say metabology, we all probably remember that there is anabolism and catabolism, where anabolism has to do with building up, catabolism has to do with breaking down. So it's a metabolic problem whereby the body is unable to properly utilize sugars. Now, that's the basic understanding. And usually, this problem comes from either from deficiency of insulin. All right. So, having said that, we can possibly have what you call an absolute deficiency of insulin, and we can have what we call relative deficiency of insulin. Now, let me explain that.
Yeah.
So, insulin is that hormone in the body that is supposed to help our cells to utilize glucose.
Okay.
Now, when there is a deficiency in insulin, the body is unable to utilize glucose as well as it should.
Right.
And therefore, what you have is you now have a rise in blood sugars. Now, why is it important to talk about an absolute and a relative deficiency? Okay, so an absolute deficiency, that is where we talk about insulin dependent diabetes. I mean, the
Okay.
body has no insulin at all. There's been destruction of the pancreatic cells. We call type 1 diabetes, but now we talk more of insulin dependent diabetes, and the person requires insulin for life. Okay. On the other hand, when you talk about relative deficiency, now relative here means that the body is still, but the insulin is not meeting the body's demands,
Right.
not only because of production, but because there is a problem of resistance, insulin resistance. So the body is unable to respond to insulin the way it's supposed to be. And that's typically what you have in type 2 diabetes, which accounts for greater than 90% of the diabetes that we see around. Yeah.
That's interesting. Okay. My next well, okay. My next question for you is this. Why is it so? What exactly is happening? You talk about insulin and all of that. So what's happening physiologically inside the body when someone develops diabetes?
Okay, thank you for that question again. So, number one, realize that when the body is presented with sugar, now it's important to realize that almost every food that we eat will eventually be broken down to sugar. All right, if you take your carbs, it is going to be broken down to sugars. If the body is deficient if the body is deficient of sugar, it's going to call on fats, all right, to be converted into an energy source that the
Right.
body can. Okay, so having said that, so there is excess sugar in the bloodstream, but because there is a problem of utilization by the cells still perceive that they are starved of sugar.
Right.
Okay, so but in the bloodstream, there is excess of sugar. Now, one of the things that can take place is that you can now begin to have alternative pathways of energy productions. For example, you can have fat cells start getting broken down. giving you fatty free fatty acids, giving you what we call as ketones, okay? And we've probably heard about diabetic ketoacidosis, right? Which is one of the things that happens where the body is unable to utilize the sugars presented to it, and then it has to now get alternative sources of energy, and then the blood becomes acidic because the body is calling on fat cells. It's breaking down other substrates in order to get its energy source. And of course, the blood sugars, but the blood sugars are still high. And what does that lead to at the end of the day? The body is going to try to get rid of that. One of the ways the body will try to get rid of it is by urination, for example. Okay,
Right.
people are going to pee a little more, but and the reason they are peeing more is because they're passing out glucose, because in the kidneys it gets to a level that sugar gets to in the blood, that the kidneys have to excrete them. Okay, so the person is excreting. Remember that, let's see, there is this, we learned osmosis in basic science, right? So
Mhm.
good, right? So when you have sugar, you have a solute, it's also drawing with it water, all right? It's drawing water, and so you are losing water at the same time. And so it's not uncommon that when people have uncontrolled diabetes, they get thirsty easily because they have been peeing out a lot of water. They get hungry easily. They lose weight significantly. So those are some of the things that go on in the body when there is this impairment in what we call glucose metabolism. Yeah.
Now, so can someone be developing diabetes for years without, because all these things are happening internally. So can they be developing diabetes for years without obvious symptoms? Because when you say, oh, the person is going to the toilet more and drinking water more, is that an obvious symptom, or that's just like one that goes under the radar? So back to my question, can someone develop diabetes for years without obvious symptoms?
Yeah, thank you very much. And that's a very, very important question. One of the things that I personally like to do as a frontline healthcare provider is to help people to prevent diseases, all right, or detect early before you get complications. I'm
Okay.
told a colleague spoke about hypertension not
Yes.
too long ago.
Yeah.
And one of the things we know about hypertension is that it is called a silent killer for a reason, right? Meaning that you can be looking for symptoms of hypertension, but one of the symptoms could be that there are no symptoms, okay? And at the same time, diabetes can present like that. It is possible for someone to be diabetic and have absolutely no symptoms. And this is one of the reasons why we keep on emphasizing the need for people to have periodic medical checks. Okay. When I sit in a consulting room, I ask people, are you hypertensive? Are you diabetic? Say, no, 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 no. And then I ask, have you ever checked? All right. Because many times people would say, well, there is no family, I don't have a family history. I'm not peeing, but you do not know until you have checked. And I have seen several people, right, who are not aware of their blood sugars being elevated, and you do a test and you find out that they do. I have a story of a patient that I often share, and he gave me permission to share this, to help people. He had just walked into the clinic, and basically because his wife was on his neck to get his blood pressures checked, okay, and so he had no symptoms whatsoever. And one of the reasons his wife wanted him to get checked is because 2 years earlier he was found to have elevated blood pressures. He was on medications. By the time, and so we went through assessing him. His blood pressures were in the sky over two. I mean, it was greater than 200. We did a fasting
Ooh.
blood glucose. We did a fasting blood glucose. It was about 18 millimoles. If you're so a diagnosis of diabetes is made at about 7 millimoles, right? His blood sugars was 18 millimoles. He did not know that he had any symptom
Wow.
whatsoever. Okay, he did not. So that's why I say, again, this can come silently, it can be asymptomatic, but this is one of the reasons that regular checks is important. So, when we in clinical practice, when we talk about diabetes, one of the things we talk about is we say, oh, diabetes with osmotic symptoms, diabetic without osmotic symptoms. Those ones I talk about are osmotic symptoms, but you can definitely have diabetes without having those symptoms. Thank you.
Hmm. Right. Okay. That's you're switching to Women Radio 91.7 FM. I'm just trying to wrap my thoughts. We're live on YouTube at WFM 917. You can send in your text messages to 0703 1756 537 or 08155 917 917. And the phone lines are now open 0800 1235 917 or 07000 917 917. So to that point, what would you say are the earliest warning signs people commonly dismiss?
So it's possible that people can come with tiredness, people can discover they're losing weight, drinking more water. But again, like I said, again, they may not have any of these things.
Mm-hmm.
And, we cannot overemphasize the need for periodic medical checks.
Yeah.
So, this is the illustration I give people. Many of us drive cars, right?
Mm-hmm.
And whether your car has a problem or it does not have a problem, you are going to take that car for servicing periodically, all right? Because you want to prolong the life of that car. They may find some things in the process of servicing. That is, if we can do that with our cars, how much more our bodies, right? Okay. So people should, even if it's just once in a, if you have no family history, no major risk factors, get your fasting sugar check once in a year.
Right.
It's at the very worst, in the most expensive of places, maybe it will be 5,000, but it won't even be up to that amount, right? Just get your fasting blood sugar checked. The truth is, if you are getting a fasting blood sugar that is up to 7, that is already in the diabetic
The red
range.
flag. Mm-hmm.
All right. But there is also what we call the pre-diabetic range. Okay. So the pre-diabetic range somewhere from 5.8 up to 7, thereabout. You are also already in the pre-diabetic range. Okay. Get a fasting blood sugar check. If your fasting sugar is deranged, then one of the things we will often do is to just ask a few ancillary investigations. One of them is what we call a 2 hours postprandial. Okay, postprandial means after meal. So 2 hours after meal, we want to check what is your blood glucose at that time. If
Right.
that blood glucose is going above 11, that's diabetic. I mean, you're diabetic, but for somewhere from like 8.6 upwards, that could be in the pre-diabetic range. There is what we call the glycated hemoglobin. So the glycated hemoglobin is a check that assesses your blood glucose over the last 3 months. Now, remember that when you do a fasting blood sugar, a random sugar check, you are looking at the spot. You are looking at it right on the spot. And many times, I've had patients that when we check their fastings or their random blood glucose and it's elevated, they say, Doctor, it's because of what I ate yesterday. It's because, okay, so that's fine. So let's check your glycated hemoglobin. If your glycated hemoglobin is high, that tells us that it's not because of what you ate
Regardless of what
yesterday.
you ate, yeah.
Yes, it's been going on for the past 3 months at the very least. Okay,
Mm,
we make a diagnosis of diabetes with a glycated hemoglobin HbA1c greater than 6.4. Okay, and it's pre-diabetic from 5.8 to 6.4 thereabout. Okay, so those are all ways that we can actually check, but I think the simplest thing that anybody can do is just get a fasting blood glucose done. The
mm.
same way you should get your blood pressure checked. Yeah.
I was laughing at that because I remember when I was pregnant with my son, I knew that I did rubbish. In fact, okay, no, let me take that back. I didn't do rubbish because I had quite a few health challenges when I was pregnant with him. And the first one was the pregnancy-induced ulcer. Then I also had
Mm.
a bit of hyperemesis gravidarum. So it was like I could not eat, but I was still hungry. So I battled with that, found a sweet spot. I couldn't drink water. But then by, I think, into my second trimester, they had done the fasting blood sugar and they said, oh, something, HB, clinical. I said, oh, it looks like you're pre-diabetic. I started crying. I was like, oh my God, my life is finished. So that's why I was laughing. I like what you said. I literally told my doctor, oh, my in-laws are around. They brought chocolates. So I had a lot of chocolate. And my doctor looked at me and said, Mrs. Bangala, which chocolate did you have? I'm talking about this. This is so I can really, really relate, with you on that note, because I knew that like in my first trimester till the end of it, I was eating rubbish. So yeah, I can actually I can relate. I can
Mm.
relate with that. When you said HB something, I was like, yeah, that sounds, really, really familiar. Okay, now we want to move change gears a bit. Why are we seeing diabetes increasingly in actually before that question? Does it matter your body size? Like I said at the beginning, people typically think it's people on the big side that have diabetes, but can we is that a myth, or are there people who are actually on the bigger side that have, but then are there people that are on the slimmer side that also have
All right.
diabetes?
Yeah, thank you very much. So that's understandable, right? Especially with type 2 diabetes. So we understand that insulin resistance is often associated with being overweight. Okay. So if your BMI, your body mass index is greater than 25,
Yeah.
right? So the possibility of insulin resistance is higher. Okay. Or if you look at your abdominal circumference, if the abdomen, and the abdominal circumference also contributes to insulin resistance. Having said that, there are tons and tons of people who are not overweight, who have diabetes. Okay. And
Right.
so it's not an exclusive criteria. It makes it more likely, but it is absolutely not exclusive. There
Okay.
are people with diabetes who have a normal weight size. Thank you.
Okay. All right. Now to the question I was gonna ask.
Mm.
Why are we seeing diabetes increase in younger people today? Because again, like the previous question I asked, you typically think that diabetes is in older people when they get to a certain age, but now it seems like we're seeing it in younger people. Why is that?
All right, thank you for that question. A lot of things are changing. You know, we're seeing diabetes in younger people. We're seeing hypertension
Mhm.
in younger people. Before now, we would almost have thought. Now, let's first of all establish that insulin dependent diabetes is commoner in younger people, or it's usually diagnosed in younger people.
Okay.
Now, that is not a problem of insulin resistance.
Okay.
Usually it has an autoimmune cause, right? Whereby there has been destruction of we call them the islet cells in the pancreas that's supposed to produce insulin. And so the body is not even producing insulin at all. There may be other autoimmune conditions, but it's more commonly diagnosed in younger people. But like I said earlier, insulin dependent diabetes is not as common as non-insulin dependent diabetes. That is the common type 2. So why are we seeing it in younger people? So one of the things you would also notice is that there's been a surge in childhood obesity, for example. So that has definitely taken place, and I have seen I have seen a few young people in their teens uh, being managed for type 2 diabetes.
Hmm.
Usually it is usually their weight could be a concern, could be one of the things that needs to be worked on. Now, one of the things we also cannot totally disregard is the fact that our diets are changing. Okay, we are going further and further away from nature. Okay, we have quite a lot of fast foods. We have quite a lot of junk, quite a lot of sugary foods. Unfortunately, the these are also not too helpful when it comes to the prevention of diabetes. So this also and other cardiovascular diseases, this also contributes in helping to precipitate some of these diseases. Thank you.
Hmm. Right. Okay. So speaking of lifestyles, the food that we eat, what is the way forward? Because on Radio Doctor, that's one of the things is a recurring theme with most of the doctors that come on, like change your lifestyle, change your lifestyle. But can you give us like practical steps that we can take from food to to physical activities to everything all around that we can do to reduce the rate of diabetes?
Yeah, absolutely. Absolutely. So one of the things I tell patients or people generally is that
Mhm.
it's never too early to start living healthy.
Mhm.
Yeah, and why do I say this, right? So oftentimes, people come in, we're looking at their blood pressures, we're like, okay, you are on the border. Okay, so it's a little high. Okay, so you said you didn't sleep yesterday. We understand. What we're going to monitor your blood pressures. I may not be in a hurry to put you on medications,
Mhm.
but it's never too early for you to make positive lifestyle changes. The
Okay.
same applies with diabetes. Okay, so what are some of the healthy lifestyle choices? It's one of it is food. It's the food that we eat.
Of
Okay,
course.
come again, ma.
I said, of course.
Yes. All right. So we encourage people to try as much as possible to take what we call a balanced diet. Now, it is not carbohydrate starvation. It is more of portion control. Now, that is very important. There is this there is a pictorial that I often like to show people. They call it my plate method. Okay. So
Okay.
if you look at so you can check myplate.gov, or all right, people can check that up. It shows you what your typical plate should look like.
Okay.
So you imagine that you've divided your plates into four. On in one quarter, you have your fruits. In another quarter, you have your vegetables.
Mhm.
Very important. One of the things that we don't do too well at. And then in another quarter, you now have your whole grain. All
Mm-hmm.
right. And I mean, the other quarter, you have your proteins, your fish, your nuts, and that. Now, oftentimes, what does our typical plate look like?
Hey.
So the
Mm.
it's like 90% is carbohydrates, right? It's 90% rice, it's 90% pounded yam and all of that. So I think one of the things we must first of all start to do is to have that portion control, be able to reduce your carbohydrate intake, increase your fruit and vegetable intake. And in fact, one of the simplest advice we give in clinics at times is that, look, just as a basic rule, yes, you're going to sit down with the dietitian and all of that to work out your caloric requirements, but as a basic rule, reduce the amount of your swallow, reduce the amount of your rice, and garnish it with vegetables. Okay. um one of the people who I look up to in terms of lifestyle medicine is Dr. Don Colbert, and he has a very interesting saying. He says, "A high fiber diet covers a multitude of dietary sins." So, I mean, just saying that very lightly. I just said that so that we can remember. But okay, but when you take lots of fibers, it regulates how sugar gets into your bloodstream. It
Mm.
doesn't come like, but it's regulated. It comes slowly. If you take a bottle of Coke, I mean, trust me, it's going straight into your bloodstream. Your blood sugars are going to spike. There is no question about that. So that's one of the advice I would give. Second is physical activity. All right. We live a lot of sedentary life now, right? You wake up, you sit on your laptop, you drive your car, go to your office. And one of the things we like to get people to do is for people to move. When I counsel people, one of the I mean, every time we talk about exercise, people are thinking about the gym. And I'm saying, don't worry about the gym. You can go to the gym, but start with walking. Start with committing yourselves to 30 minutes of brisk walk a day. And
Yeah.
if we look at the physical activity recommendation for adults for the World Health Organization, 150 minutes of moderate intensity exercise in a week. So if you have 30 minutes in 5 days of brisk walking, you're doing something, okay? So
Mm.
let's start with that. We also encourage people that after eating, don't just go lie down and slump. Move around a little, just move around a little after you have eaten, and then come back and sit down. Our sleep is important. Sleep is something that is being challenged in our society today,
Yeah. Yeah.
unfortunately. But whether we like it or not, sleep is important for our overall health because it's meant to restore our cells, it's meant to restore our function. Now, one of the things that you would happen when you do not sleep well, unfortunately, is that your hunger hormones would actually upsurge. You would likely munch throughout the night. I mean, you would likely have to find something throughout
Oh,
the night.
true.
Okay.
True.
Yes, and your satiety hormone is suppressed. But when you sleep, that also helps to regulate your metabolism. The recommendation is 7 to 8 hours of sleep. That's
Mhm.
all. People always fight that, but I mean that's just what science says, and there is enough science to show us what happens when people don't get enough sleep. Managing stress. Managing stress is extremely important if we're going to control diabetes. Now, the illustration I like to use is if a lion enters your room, let's assume you were sleeping or you were before the lion entered. Immediately you notice that lion, the sleep will clear from your eyes.
Yeah,
Your heart rate is going to increase. Your
absolutely.
blood pressures will go up. The energy you did not have before, it's going to come. One
Very
of the ways you get that energy is that the body mobilizes glucose production, all right, so that you can are able to do what we call a fight or a flight.
flights,
All
right?
right. Correct. So what you do with a lion, whether you fight or fly, that's left to you. But remember that that is a stress response. Now, imagine that your body is under that kind of stress continuously. And don't we get under those type of stress? Deadlines upon deadlines, meetings upon meetings. You are late for work. I mean, and so sometimes for our own good, we need to begin to prioritize managing our stress. One of the ways to manage stress is to learn to say no. I mean, because you cannot be everywhere. Okay, you have to be able to prioritize. You have to be able to prioritize, to plan appropriately, so that if you have a meeting, you are not under pressure to get to the meeting. Your heart is not racing because you're almost late for work. And so we need to look at how to manage stress, uh,
Mhm.
generally, how to have what we call relaxation, deep breathing. And the truth is, in the in our Niger parlance, one of the things they say now is that they say wahala no they finish, right?
You know
And the
they
truth,
finish.
right, and that's the reality. No, if you like, you can work from now till the end of the year without a
Mhm.
break. There will still be work to do.
Yeah,
But
well,
you have to prioritize yourself. You have to prioritize your health. Thank you.
wow, that was really, really exhaustive. Thank you so much for that. I like how you also touched on sleep, and the sedentary living that we have. We're always sitting on our desks. One of the things that stresses me out is walk. Well, I love to walk. It's just that sometimes I'm like, oh, but I like that you said that it can be just 30 minutes every day. 30 minutes every day 5 days a week is better than doing 1 hour or 2 hours once a week and saying that you're exercising. I love that. I
Yeah,
love that.
and let me say something to that. When you look at most health guidelines with regards to physical activity or exercise, the
Mhm.
word there is regular.
Mhm.
Regular physical activity. And
Yeah,
so one of the things we like to remind people that, your physical activity, your exercise should be a lifestyle and not an event. All right. Yes. So it becomes an event when it's something you do just once a month. And yes, you can cover a lot, but you gain more by actually being regular, making it part of
regular.
your life. Thank
Yeah.
you.
Thank you so much. We're still speaking to Dr. Adewale today on Diabetes on Radio Doctor this morning. I'm still expecting your calls or your text messages to ask the doctor questions on your health. Okay. When it comes to diabetes. Okay, let's talk about management of diabetes. Can diabetes truly be controlled successfully long term? Or is it something that you have to manage till infinity?
Okay, thank you. Thank you very much for that question. So let me just talk about the management first and then come to that question. Right, good. So the first step in the management of diabetes is lifestyle. It's lifestyle changes. That is the first step. And that is so important because we need to realize that to a large extent, lifestyle also contributes to the development of diabetes. You can prevent or delay the onset of diabetes by making positive lifestyle changes. Okay, so that's the first thing I would say. Um, can it be controlled in the and I'm coming to medications and I'm going to talk about that. But is it possible for someone to actually have a reversal, if that's the question. And yes, there are evidences that people can have reversal of some chronic illnesses, but usually this is with a lot of intensive lifestyle changes. And I would say this should be something that is supervised. One of the fields of medicine that is becoming more prominent in Nigeria today is lifestyle medicine. In Nigeria, we have what is called Society of Lifestyle Medicine of Nigeria. Okay, so that's something, and so you could have, but you need to have that supervised. Having said that, having said that, there is a level at which your blood sugar or your diabetes will be at where we can start with lifestyle modifications alone. But there is a level where it will be at where it may be counterproductive for us to start with only your lifestyle changes. And this is very important because diabetes can have its complications. And let
Right.
me just mention some of the complications. I mean, I've already talked about ketoacidosis the other time. There's
Mm-hmm.
another one where we call hypertensive hyperglycemic hyperosmolar state, and oftentimes people come into the hospital, they are dehydrated, they are unconscious, their whole metabolism has been altered. I mean,
Yeah.
sometimes people get seizures and all of that. These things can be life threatening. Diabetes increases your risk of heart attack, your risk of a stroke. Yeah, your so we the risk of getting eye damage and much more. And so, usually, if your diabetes is still mild, we can talk about lifestyle changes alone. But depending on your physician's assessment, there may be a point where the safest and best thing to do is to start you on medications. And the reason for this is simple, that we don't want you to develop a complication while trying to make your lifestyle changes, which is
Right.
something that is going to take a while. Okay. Now, two things I would just say, and then I'll just give room for other questions or comments
Questions.
you may have. Okay, so starting of medications, many times people are hesitant when you say they need to start medications, but
Mhm.
one of the reasons we need to start the medications is to support your metabolism and be able to help to bring your glucose to a safe level.
Mhm.
Look, if you get to a point where we think your blood glucose is safe, we are happy to step down your medications, okay, as the need may arise. Secondly, is the concern about insulin.
Okay.
Now, because I hear this all the time, sometimes in cases of severe elevated blood glucose, what we call hyperglycemia, and or in some cases, we actually have to admit people, start them
Mhm.
on intravenous fluid, start them on insulin
Mhm.
for some time. Now, one of the things the myth that people believe is that, doctor, I've been told that the moment I start insulin, I'm
Mhm.
going to be on it for life.
Whatever. Mhm.
And that's the reason they don't want to start. But that is not absolutely true. We have started people on insulin and taken them off insulin when their blood sugar could tolerate it, and maybe we maintained them on just medications and lifestyle changes.
Mhm.
But sometimes you need that insulin at that early part to also help in the control. Having said that, there are people who have had diabetes for a long time, that their pancreas has become so weakened that they almost are no longer producing insulin sufficiently
Mhm.
again. Such people may need lifetime insulin support. Thank you.
Okay. So, how important is family history when it comes to diabetes? Because I mean, I think I should have asked this question at the beginning, but how important is it? Because I suppose that helps in knowing how often a person should check or the management plan for the person.
Yes, absolutely. Family history is important. Family history is important. If you have a first degree relative who has diabetes, of course, your chances of developing diabetes is higher. I mean,
Mhm.
so if you have like your mom or your siblings, your chances are higher. If you now have both parents, your chances are, I mean, even multiply by several factors. Okay,
Mm,
so that's very important. The Yorubas have a saying that, let me just try and paraphrase it in English, that when your eyes are sunken, all right, before you get to where you are going, you start crying, so that at least by the time you get to where you are going, they will be able to see the tears. Okay. The whole idea is this: if you do have a family history, then it becomes important for you to take to take it on more seriously,
yes.
okay? I mean, to start checking, I would say if you can check like twice a year, if your numbers are good, you can do at least twice a year.
Mhm.
Just check your blood sugar. It doesn't cost that much. I have a colleague in one of the medical teams I belong to. She's a pharmacist, and when we got taught, I mean, she was telling me about some of her lifestyle practices with regards to jogging, as in taking on healthy lifestyle practices. And I was pretty impressed, and I was asking her, what's your motivation? She said, diabetes, they run for my family. I'm not ready.
Eh,
Okay, and she's been able to keep herself in very good health because she has taken the family history as a good indication of need to intensify her own preventive practices. Thank you very much.
Last week, before we go, my last question to you is for someone who's listening right now who maybe suspects that they may be at risk, what immediate steps should they take, like this, as they've been listening to you on this program?
Go out, get your blood sugar tested. don't wait don't wait for ants to crawl on your urine.
Hey.
Yes, I mean, because that's what people would say. They say, oh, I pee, but then ants do not crawl on it. But
Ugh.
remember that your blood sugar can be high and it will not spill into your urine. Okay,
Mhm.
so just get your sugar tested. I mean, maybe just do a fasting blood sugar, because that may be a little easier for us to interpret, for us to relate with. Of course, we can interpret a random blood glucose too. If it's greater than 11, then um of course we're worried. But that also depends on when did you eat your last meal and all of that. So I would say just get a fasting blood sugar. So I stay in Abuja, and for even in private hospitals, a fasting blood sugar is probably somewhere between 1,000 to 3,000 naira. You can
Okay.
get it done. Yeah, and one of the things I tell people, by the time people are getting into their middle age, by the time people are getting into 40, one of the things I say is that have your own blood pressure monitoring machine at home, have your glucometer at home. It doesn't, compared to what it can save you, it doesn't cost that much. Thank you.
Thank you so much, Dr. Adewale, for coming on the program today. This was a very, very interesting, conversation, very insightful as well on diabetes. If you'd like to speak privately with Dr. Adewale, you want to download the TeleDoc app today and book a quick 10-minute or 30-minute consultation with him. Once again, thank you so much, Dr. Adewale, for coming on the program this morning.
My pleasure. Thank you for
Enjoy.
having me.
Yes, enjoy the rest of your day.
You too. Thank you very much. Yeah.
Alrighty. Okay, Radio Doctor is broadcast Mondays through Fridays by 10 a.m. on Women Radio 91.7. Up next is a conversation to mark the World Menstrual Health Day with YEF up next. Don't go anywhere.
are Nigeria's only radio station for women.